Welcome to the Community Voice, the show that's dedicated to our community. I'm Farah Sachs. This show on Fridays spotlights the members of the Aventura Marketing Council. And joining me is the Aventura Marketing Council members, the Aventura Hospital and Medical Center, Dr. Trish Stevens, who is the Chief Medical Officer, and Dr. Allan Stewart, who is the medical director of cardiovascular surgery, is with me in the studio. My hope is that today's show provides useful information about COVID and the Delta variants to keep you and your family safe. Thanks for tuning in. And thank you for joining me.
Thank you for having us.
Thank you. Let's talk about, Dr. Stevens, the COVID variants and what's going on in the US and in Florida and what that means to our community.
Absolutely. Thank you for the question. I think that's an awareness that needs to be raised. There is about 85% of all infected individuals with Delta variants, and that is across the United States. We also see that here in the Miami-Dade market, and it's consistent in the test positivity and in the hospitalization. The difference is that all the people who've been hospitalized thus far with the Delta variant has been unvaccinated individual.
So that leads me to say maybe there needs to be more vaccinations happening.
Absolutely. We have a good rate of vaccinations among the older population, 65 or older. The first dose is 92%. The one that got both doses about 88%. So they are protected. What we see is a younger shifting populations in the 20s and 30s that have not been vaccinated. And it's a missed opportunity to protect yourself, your family, and your community. The difference also, the Delta variant is more virulent. It is more infectious, so you're likely to spread it. And if you do get it, you are sicker. Again, vaccination is so important, and it does not discriminate against age or race or ethnicity. So you need to protect yourself.
Dr. Stewart, what are you finding in when you're dealing with patients? Your areas of expertise are more the cardiology, cardiovascular. So are you seeing any difference now from the Delta from where we were, let's say, a year and a half ago with symptoms or with how we're presenting?
Yeah, it's a great question. And the answer is it's somewhat complex because not only are we seeing people younger and sicker, people are coming in gravely ill that are in their 30s and 40s and are needing to be put on the heart-lung machine just to keep them alive. And
what is the rate of that? I'm sorry, but what is the rate of getting off a ventilator if one is put on one?
Well, there's not a lot of great direct treatments for COVID once that severe reaction occurs, and we're just trying to support the body and allow it to heal. But by the time they're gravely ill enough to need to be on a heart-lung machine, the survival is very poor. It's less than 10%. And we're seeing that now in 30 and 40-year-olds. In the past, when we first started to have the pandemic in March and April, it was generally the older population. But now they've managed to be vaccinated, as Dr. Stevens said, and so it becomes a numbers game, right? The older than 65, they're all vaccinated, but now the people who are left who are unvaccinated are now the preponderance of folks who are getting severe disease. But what I've seen from before and after are we essentially locked ourselves away for a year and a half, and that absence of structure has led to greater incidence in obesity, worse nutrition, higher rates of smoking, excessive alcohol consumption. So the people who are coming in are, in many ways, the quarantine made us worse candidates to fight COVID because all of our bad habits got magnified while we're quarantined.
What an interesting point. I didn't even
For
think of that.
For a snapshot, the last 3 waves that we have here in Miami-Dade market, the portion of the people that get hospitalized needing oxygens that need to go to ICU with positive pressure ventilation, either a BiPAP or intubation or ECMO, was 9%. With the Delta variant, we see 25% of hospitalized patients end up in ICU, and about 5% of them need an ECMO. We also see an increase in death rate, usually trailed by 4 to 6 weeks, but just the uptick alone this past 3 weeks, we saw the death rate increase 13%. So as you see, this is not a mild disease, but unfortunately, it's an avoidable hospitalization.
So the Delta months ago, a couple of months ago, was only 3%, give or take a couple. And
Yes.
now we're at how much?
The Delta variant for infections right now, popularizing in the infected individuals, about 90% in the United States. And it's the same percentage here in the Miami-Dade County. The mortality increase among the hospitalization is 13% increase as to before. Even at the height of the pandemic, we did not see our mortality cross 1%. The past 3 weeks, we're looking at 1.5% in the Miami-Dade market. So for every single individual that is hospitalized, their risk of demise is a lot higher with this variant.
Who is the most affected demographic for COVID first, and now the Delta Plus? There's a lot of going on. So let's talk first about the Delta Plus. What's the difference between that? Because I just saw that happening and I was like, whoa, more to fun to think about and more things to have to really deal with and put a strain on our healthcare.
So that's a great question. Thank you. COVID virus is unique that it has the ability to mutate really quickly. So the variant that we've seen before, it's labeled by the Greek alphabet. There's a beta, there's a alpha, there's a lambda. It's not as virulent. The Delta variant is virulent, but as it jumps from people to people with spreading, it's mutate to get stronger. And the Delta Plus is now stronger. We don't know the mortality rates of that yet because it does lag about 4 to 6 weeks. But the symptoms is a lot more virulent. People are getting sicker faster, demanding oxygens faster, and they are affecting younger people. It's not that we did not see young people get tested positive in the past. They do, and they did, but without the Delta variant, they're less likely to be in the hospital. With the Delta and Delta Plus, it makes them so sick that they end up in the hospital. And Delta doesn't really care how old you are. The difference is the population in 65 and older has been vaccinated, and vaccination give you about 80% protections against the Delta variant and 95% protection against all variants. So right now, the most vulnerable populations is the one that's not vaccinated, regardless of age, and they are end up in the hospital. And coincidentally, it happened to be the younger demographic that has been declining the vaccine. So now we see more of them in the hospital. And there's a correlation. If you look at the United States maps, the pocket where the vaccination rate is less than 50%, the hospitalization rate is high. The lowest is Alabama, Florida, somewhere in between of 52%. You have Vermont, Massachusetts at 74% vaccination rate. So
why are we so high? Why is Miami-Dade? Let's just take Miami-Dade. Why are we so high, Dr. Stewart, in this variant, as well as, are we vaccinated enough, or have we reached the critical mass that we needed to reach?
No, we've not been successful at vaccinating our population. People are declining it. Even healthcare professionals have declined the vaccine. It's mind-boggling to me why that's the case, but we don't have a high enough vaccination rate, and we have behaved in Miami as if the pandemic's over. So the nightclubs are packed again. The beaches are packed.
So are you referring that this is a younger population that is getting sick for both of what you're both saying? Yes. That. So what needs to happen? What do you think would be the logical sense? Are we shutting down again? Or we're masking again, obviously, because I know that was a mandate that was just put out, and that Miami-Dade employees need to be either vaccinated or once a week, have a swab.
We're always going to be safer wearing a mask than not wearing a mask. To require it, and whether it should be mandated, that's beyond
but on your scope, I know.
Beyond my scope. But I would say that if you're not going to be vaccinated, then you need to wear a mask. It's that simple. But it's just foolish to not be vaccinated. There is no conspiracy. There is no rare I Am Legend event that's going to happen that's going to kill off the whole population if we're vaccinated. That's just nonsense.
What is some of these? Where did some of this misinformation and myths come from? Let's debunk them while we're on there. I heard that someone referred to the vaccine is a way for the government to put a chip into us. I've heard so many crazy things, and let's talk about that. What is in the vaccine that people should either feel comfortable with, and if they're not comfortable, just do it anyway? Maybe, seeing what's going on now. What is your?
So there is no chip in the vaccine. And honestly, the way we are being tracked is internet usage, cell phone usage. So I have news for you all. You've all been tracked by your cell phone usage. If you own a phone, you are tracked. So
do you ever look up something on something on Google, and all of a sudden you're getting ads? I'm like,
absolutely.
How do you know? How do you know?
Absolutely. You're being tracked through the cookie usage through your cell phone. So if you're concerned about that, already happened.
What's in the vaccine?
The vaccine is a short protein that elicit the messenger RNA. It's ribonucleic acid that activate your B cell lymphocytes and your immunity to produce the antibodies to bind up the COVID virus if it should enter your body. The uniqueness of the vaccine is that it is a short segment. It does not cause COVID, and it does not enter your cell. It does not pass your cell membrane, so it does not enter your genetic material, and it does not affect women of reproductive age. And it's actually very safe in pregnancy. Our New England Journal of Medicine study came out. There's several young female who got vaccinated during pregnancy and prior to pregnancy. Their newborn tested positive for the immunity against COVID. So it's actually the best way to protect yourself and your unborn child or your, yet to be born children against this horrible disease that is not very forgiving for the human race at the time being.
And I know that we're not approved yet for under 12.
Correct.
Do you think that's going to be coming down the pipeline?
I believe so. There is study and research out there that show that it's safe down to about 2 years old. So it's a huge consideration with the FDA, and I think it's down the pipeline, and I believe it's much needed.
Dr. Stewart, one of the questions I've heard people throwing around a lot, does the vaccine lose its ability to protect over time? Does it loses? So we have to maybe get a booster. Is that something to be considered?
It's a great question, and obviously the vaccine has not been out for a long period of time, so we don't necessarily know its longevity. This, in part, all of the information we're getting is real time, and we're learning as we go. And the fight is between getting enough people vaccinated and so we can have this virus sort of put under wraps. And for us to start thinking about a booster shot when a large portion of the world hasn't received one shot is somewhat confining or isolationist. The goal is to stamp it out of the world. And so for us to start thinking about a third shot when we can protect other countries and get it under control in areas of Africa and Asia that haven't gotten any doses yet, I think is wrong. So I think for us, we are citizens of the world, not just the United States. So yes, we want to protect our country, but we also need to get it under control because even if we vaccinate everybody in the U.S., but it's allowed to just run and wreak havoc in other underdeveloped countries. Well, when travel restrictions are lessened, you could have these mutations that our vaccines won't protect us again, and then we're going to be right back into the cycle. So we need to get rid of it in the world rather than just a country.
Absolutely. That's a great point. And so are there programs being instated right now? Are there organizations? What's happening on boots on the ground with that?
It's not enough. We certainly haven't, and a lot of that is it's politically based, right? We are, there's distrust of the World Health Organization. There is distrust of global distributions, and I think that's a lot of what's happening. Is this very radical politicization of our country that we don't have a uniform belief of who should get a vaccine and how it's being distributed. So I think there has to be a greater effort to get as many citizens of the world vaccinated.
Absolutely. And as a cardiovascular surgeon, what have you been seeing? I mean, we started somewhere 19 months ago to today. What has there been any difference in your patients and what you're seeing in hospital? Just any which way you want to share the information.
So COVID affects the heart both directly and indirectly, and why people who have heart disease are worse off is because of the strain that it puts. With any viral infection, your heart rate increases because you get a fever. So your oxygen levels drop with COVID. There's an inflammation that exists, and all of that, so that the heart rate, the fever, the strain, the lack of oxygen puts a strain on the heart. So people who have pre-existing heart disease tend to do much worse, because if you're in a normal heart, there is some degree of inflammation when you have a virus. But an abnormal heart, someone with coronary disease, someone with diabetes, someone who already has a impaired function of the heart, now they're putting a load on that, which is oftentimes too much to bear. And so we're seeing more fatal events with people with pre-existing heart disease. But also in folks who have normal hearts, there is some degree of inflammation and some direct effect of the virus on the heart. It's generally mild. It generally doesn't last and can be treated with rest and ibuprofen. But for those who have pre-existing coronary disease, they tend to fare much worse when they're infected with COVID. But what I'm seeing in the last 19 months are that people have not kept their regular doctor visits. So they've not managed their diabetes well, their hypertension, so they're not getting their medicines, they're not seeing their doctor for their chronic conditions. They're afraid to go to the hospital, so they're having heart attacks at home. And then when they're short of breath, they think, oh my God, I have COVID, when they're really having a heart attack, and it has nothing to do with COVID. And so the people who are coming in for surgery are much sicker than they were a year and a half ago.
Because they either waited or because other things have happened.
Yeah,
correct?
they haven't managed their chronic conditions well.
Chronic conditions being what?
Like high blood pressure, diabetes, high cholesterol. So they're not taking their medicines. They're tend to stress eat, eating poor quality foods because they're not going out to restaurants. So they're ordering in and generally ordering in something that's quicker or not as nutritious, not exercising, not being out in the sunlight. So the vitamin D deficient, they're heavier. And that stress of not knowing when the world is going to come back to normal creates a stress response called an increase in cortisol, which is a stress hormone, and that gives you that belly fat and inflammation. And so the folks that are coming now for surgery, I have all this constellation of things happening to them, and they're sick. And the advice, not only, as Dr. Stevens mentioned over and over again, of getting vaccinated, yes, get vaccinated, but also in this time of uncertainty, it's the time to hit reset on your life and begin to an exercise program, manage your diet, treat your chronic conditions, and make yourself a better candidate to fight the virus in the event that you would get it.
So after this show, they all need to call your office to make the appointment, to set it up, to make sure they're good to go, and you're going to put them on a nice program so that they can really have a full life, right?
Yes, absolutely.
What are some of the long-term effects on the heart that you've also seen with COVID? And probably too early for Delta, but what have you seen so far?
So there was, at one point we were concerned about something called myocarditis.
What is that?
Myocarditis is inflammation. Anything itis is inflammation. So myo is heart. Myocardium is heart muscle inflammation. And there were about 300 or so reports of people who were vaccinated and had this inflammation of the 200 million doses that were given. So it's a very small number. And that was cause for concern initially, that maybe the vaccine was causing people to have inflammation in their heart. Proved not to be true. There have been... So
that was one of the
myths.
We're demystifying, debunking. Good.
Same with the infection itself. There was some fear of inflammation. But that's also been considered a myth and not different than the general population. But what does happen is this inflammatory syndrome that can exist affects the blood vessels, and not only in the heart, but also for the young healthy men that have said, well, I'll just get COVID. There are instances now that we're seeing this inflammation in blood vessels that can cause impotence. So people, a rare but real effect of COVID after recovery is that an impairment in the blood flow to the male sexual organs that will prevent erection. So that's another reason to get vaccinated. But this,
so it's the first time I've ever heard of that.
Yeah.
First time. So we talk about infertility, but now we're talking about for men, what happens to men.
Yeah, it's very real.
Really?
Yes.
It's idiosyncratic. That means you can't predict who it's going to happen to. However, if it's the incident that happened to you, that's affect your life 100%. So it's devastating. It's life-changing for a young male. That's more of a reason to get vaccinated. And it's been proven that vaccine does not cause that condition at all. So one sure way to avoid that to affect you is to get vaccinated.
Absolutely. And what is Aventura Hospital and Medical Center doing in preparation? What have you seen? What are the nurses and doctors dealing with on a daily basis? And we got to flatten this curve again and get it to be.
Absolutely.
So just tell us what plans are in place right now.
So the biggest plan that we have that has been continual of the pandemic is that safety first. We have universal precautions. We are masking, vaccinated or unvaccinated. We are masking. We are wearing face shield. We practice safety precautions for all of our patients. And because of increase in the COVID volumes, we are making special expanded capacity to take care of those COVID patients alone, and also separate COVID patient outside of non-COVID patients to keep them safe and to keep their families safe. We are continuing with our evaluation of all the critical, urgent, and emergent cases to make sure that the clinical needs is not appended in the community. Just like Dr. Stewart said, if you ignore your other's chronic conditions, it will adjust your entire curve in terms of the ability to fight COVID. So we are taking care of our community and our patient at the same time. We are prepared in terms of oxygen need. We are prepared in terms of ventilation need. We have made extra capacities now the third time for this Delta variant to make space for our COVID patients, trying to help each and every one of them that end up of our door. We also make sure that we have a stockpile of our PPEs to be prepared to take care of our staff and our patients.
How many beds do you have that are dedicated?
We have 476 beds in the hospital total. Our volume day to day right now, we've seen about 35% of all our patient is sick.
Yep.
And it's interesting along those lines. So when Dr. Stevens is looking at it from the point of view of well, how do we occupy space? And if you think about it in terms of, we have to keep the COVID patients separate from non-COVID patients. So there's a finite amount of ICU space, and we have, if you think about it in terms of blocks, right? And say you've got 4 different blocks of 10 beds. If you get to 11 COVID patients, well, you've now got to take a second block, and now that becomes a COVID unit as well. So even though you don't have maybe not have 20, there's 11, 10 are in one. The minute you spill over into another, you have to shut down that entire ICU and make it a COVID ICU. So now 50% of your capacity is gone. Now, if you get to 21, now 75% is gone. And that impacts the ability to do other surgeries. So when these folks show up and they tend to be on a ventilator for a long time, they don't just go on for a day or two. I mean, so these are folks that are going to be in the hospital for a protracted period of time once they get that sick. And that shuts down our ability to do regular heart surgery or orthopedic surgery, cancer surgery, and it impacts the ability to care for other people. And this surge that we're getting now, we're seeing it in all of our hospitals in Miami-Dade, and there are many that have shut down elective surgery already.
What about Aventura? Have they yet?
We are deciding that because of the need of the community, we cannot postpone another medical need. So we are evaluating cases by clinical needs, prioritize the urgent, the emergent needs, and make space for the one that really, truly need the medical care. But we are not shutting down because it's doing a disservice to the community. Even though COVID exists and it's devastating, there are other diseases that are still life-threatening to a human being, and we are trying to take care of the community the best way we can, balancing both.
So the million-dollar question is, the million-dollar question, how can we convince people, having information that you just shared with me and with our audience, how do we get them to take that step so that we can finally just get this under control, live our lives to the fullest, and get a shot in the arm?
So what I'm going to say to the general population is, the longer you wait to get vaccinated, the more chance you allow the Delta variant and who knows what come down the pipe to mutate and become more virulent and decimate our community. Each and every one of you have a responsibility to protect yourself and to stamp out this pandemic and to stop the mutation. So you need to go and get vaccinated. That's the only way we're going to win this war.
And to add to that, I think that in the beginning, when the preponderance of people that were getting gravely ill, at least what was reported, that they were elderly, obese, comorbid conditions, nursing home residents. Well, so the younger people would say, well, for us, we're fine. I'm a young, healthy 40 or 50-year-old person.
We're invincible, aren't they? They're
right?
invincible.
So
They're
I don't
live
need
forever.
it. I don't have any of these conditions. But what we're seeing now is that, well, that group got their act together and they all got vaccinated. And now this other population of people are now making, they're the folks that are getting quite ill and showing up to the hospital. They don't necessarily have this big constellation of symptoms. Our country is, 38% is considered overweight. We have a lot of diabetes. A third of our population is diabetes. So we do have a lot of comorbid conditions regardless of age. And each individual person owes it both to themselves to be vaccinated. The folks that I see that are going to put on a heart-lung machine or on a ventilator, they all regret not being vaccinated at that point.
Say that again.
That everyone that I see that is going to go on a heart-lung machine or get intubated looks at me with this regret of saying, they said, can I get a vaccine now? And I said, no, you got it. You got the virus.
You had the chance.
You had the chance. And there's no one who is gravely ill that says, I'm really happy I didn't get vaccinated. So I think it's not only a individual's responsibility to get vaccinated because it's a treatment. It's there. It works, and it prevents the severe infection. And you owe it to yourself, and also to the population, to not infect others by being infected yourself, and also to prevent hospitals from being overrun, so that folks who need treatment for other diseases have a bed available to them.
I just want to do a shout out to all nurses and doctors in this setting. It's just what you have had to deal with over this time. And it's just, thank you. Thank you. In the time we have left, final statement, something that we didn't cover that you want to share.
Absolutely. We are honored to be part of this community, to take care of this community. Aventura Hospital and Medical Center has been in great partnership with the Chamber. And we're appreciative of the patients that we've come cross path, the life that we save, and also the opportunity to educate the community and help move the needle, changing the landscape of this community wellness. And we hope that each one of you take yourself seriously, be a responsible citizen, get the vaccine so that we can return to normalcy, because life is worth living. Thank you.
Dr. Stewart?
I think that in addition to, again, emphasizing that each individual person needs to be vaccinated in this period of time where our world is not back to normal just yet. An acronym that I use a lot is MEDS and MEDS, which is take time to spend 5 or 10 minutes meditating. There are plenty of apps to reduce your stress.
So cortisol,
yep,
drop
your cortisol, just a little me time. There's plenty of Headspace, Calm, Jay Shetty. There's plenty of apps available. Choose one, take 5-10 minutes each day and just lower your heart rate, work on your breathing. E is for exercise. Get an exercise plan, get your weight down, get your body moving. Don't get absorbed into this defeatist attitude. D is diet. So get your, input and output depends upon how much weight you have. You take in more calories than you expend, you're going to gain weight. So be mindful of your diet. And S is sleep. While we're structured and working at home, and we've not necessarily back in the office, and we're focused on a screen constantly, we tend to not have our normal sleep cycle. So meds is something that I think everybody should pay attention to, and hopefully this will be beyond us sooner rather than later.
And I appreciate both of you, Dr. Stevens and Dr. Stewart, for coming in today and sharing. And I'm going to have him write a script for meds, okay? I'm just going to have him do that. And I want to thank you for tuning into this really important discussion that we had on the community voice. Stay strong, stay safe. Have a great day.